This is the notorious Moria migrant camp on the Greek island of Lesbos. It's overcrowded, dirty, and thousands of people have no access to water or toilets. It was a health hazard long before the coronavirus pandemic. Now, experts fear it will become a lethal breeding ground for the deadly disease.
Unfortunately, in Moria, the preventive measures sounds to these people as a joke, because how can you ask someone living in a tent to go back and isolate in his room, to increase their level of hygiene if there's no even enough toilet and shower and water point in the camp?
It's a similar situation across the Aegean Islands, where some 42,000 refugees are crammed into camps intended to house only 6,000.
There is one water point in Lesbos for 1,300 people. There is one latrine for 167 people. There is one shower for 200 people. So it's the perfect place for the spread of the disease. It's a perfect place between brackets for a disaster.
As of now, there are no confirmed cases of COVID-19 inside these island camps, but at least 20 cases have been confirmed in a camp outside Athens.
1, 2, 3, 4, you breathe in and you breathe out.
Organizations like Doctors Without Borders are calling for an action plan and the immediate evacuation of island camps.
On Thursday, the EU Commissioner for Home Affairs said that an emergency action plan has been agreed upon. It includes plans to evacuate the most vulnerable individuals from these camps and place them into vacant hotel rooms. It also calls for additional medical supplies and funding, but it could be days, if not weeks, before it makes it where it's most needed.
In the meantime, humanitarian groups have been filling the void. The UN Refugee Agency, UNHCR, has appealed for $255 million to help lessen the impact of COVID-19.
Ultimately, the virus doesn't discriminate, and we can't afford to either. This means we need to work together to tackle the virus, and at the core of any response, we need to ensure there is empathy and quality.
Something some would argue is in short supply, even in normal times.